So in the 3 books of Dr. Sarno that I've read, he has mentioned many times that only around 10 to 20% of the population will acknowledge this diagnosis of TMS. And the question is, why so few people acknowledge such a diagnosis? If it's curing people and people can live much better lives without all the medication, without the surgeries, without the injections, without the restrictions of life, without all that physical therapy, why do so many people dismiss it? It's really twofold. The first reason is because it's stigmatized. If you try to tell this to most people, they get defensive. They think that there's something fundamentally weak about them. There's something wrong. There's something missing. That you're trying to tell me it's emotionally induced, so that means I can't handle life correctly. I don't have enough of me to handle the stresses and responsibilities of life, and therefore it's dismissed. It's just totally opposed, because no one wants to think of themselves as not worthy to take on life's challenges, etc. So that's the biggest reason. After that, you just look at the medical community and how it has been shaped over the last 50, 60, 70 years. It's become very, very test-oriented. It's what we see on an imaging, what we see on a blood test, and if you don't see it on a blood test or an imaging, then you either have to take medication, maybe there's something wrong with you, maybe you have to do stress reduction. Cognitive behavioral therapy is something that doctors will tell you to do a lot if they can't find anything on test. And if they do find something on test, they'll misdiagnose you and say, hey, the reason why you have chronic pain, the reason why you have nerve pain is because the nerve is compressed or because you have a herniated disc, when in most cases, a lot of cases, it's because of TMS. And because the doctors are not willing to admit it to themselves, and because we as patients are so easy to agree to doctors and we will never disagree, we're not going to oppose medical professionals, we tend to just go along the same boat and say, hey, well, my doctor said it's physically induced. My doctor said the reason why I have chronic pain is because of a herniated disc. So I guess I'm just going to have to sit in bed. I'm going to have to do physical therapy, take medication, take the injections, take all these things. Whether it might be that, it might be gastrointestinal, it might be allergies, all these different chronic symptoms and conditions. We're just going to believe our doctors and listen to them and do what it takes to get the symptoms under control. But the problem is, like we always say, you're not actually getting the symptoms cured. You're managing the symptoms, as opposed to someone who acknowledges that what they have is TMS, a mind-body disorder. The pathway to getting better is actually curing the condition from the root. Like we always say, you're not just managing symptoms. You're getting rid of the symptoms by curing the condition. And that is the basic fundamental difference between TMS and the diagnosis from your doctors. The diagnosis from your doctors are misdiagnosed. TMS is the accurate diagnosis, and that's where people really see legitimate results, and it's long lasting. You are curing yourself.